So on page R1, we are reminded at the top, endocrine glands are glands that secrete hormones into the bloodstream. Hormones are chemicals secreted by endocrine glands that circulate in our bloodstream and cause changes to what the cells do. We've already mentioned the pituitary gland, which is attached to the base of the brain, to the hypothalamus of the brain. We've learned that the pituitary gland is commonly called the master endocrine gland of the body by virtue of not only how many hormones it secretes so many hormones, but also the fact that many of the hormones control other endocrine glands. But I want to focus at the bottom of the page that the pituitary gland, specifically the adenohypophysis, secretes two gonadotropic hormones. What does gonadotropic mean again? Tropic means to affect, A-F-F-E-C-T, to affect the gonads, to affect the reproductive organs. And what are those two gonadotropic hormones? One's called FSH, and the other is called LH. But I've written them on the next page. On the next page, so I said I was going to tell you a little bit more about this. FSH is follicle-stimulating hormone. LH is luteinizing hormone. These are the two gonadotropic hormones, the hormones that affect the reproductive organs. Now, let's first summarize what FSH and LH do in guys, and then we'll summarize what FSH and LH do in females. I will tell you this much, guys are simpler to understand than women. Okay, FSH, follicle-stimulating hormone, causes the testes of a guy to produce sperm. That's what FSH does. Literally, if the pituitary gland doesn't release FSH into the bloodstream, the testes of a guy will not make sperm. So that's literally controlling the testes to make sperm. What does LH do in a guy? LH, this luteinizing hormone released from the pituitary gland, the adenohypophysis, into the bloodstream, causes the testes of a guy to secrete the male sex hormone testosterone. Without LH from the pituitary gland, if LH isn't secreted from the pituitary gland into the bloodstream, the testes of a guy will not make the male sex hormone. So the functioning of the reproductive organs is dependent upon the functioning of the pituitary gland, the master endocrine gland. All right, that's pretty straightforward. What does FSH and LH do in females? It's more complicated. FSH causes the growth of an ovarian follicle. In fact, that's why it was named follicle-stimulating hormone. It causes the growth of an ovarian follicle. So the FSH was named for what it does in women. It was not named for what it does in guys, even though it affects the testes and ovaries of the man and woman, respectively. Not only does FSH cause the growth of an ovarian follicle, and at this moment you're probably thinking, what's an ovarian follicle? We'll clarify that. An ovarian follicle is a structure containing an egg inside it. But FSH also causes the follicle cells to secrete estrogen. All right, so we have to explain what all that means. Now, what does LH do in a female? LH causes, excuse me? LH causes ovulation. It causes the egg to pop out of the ovary. And it causes the follicle cells to secrete progesterone. All right, we're going to clarify all this as we go on. Here I've written the word puberty. Puberty is the period of sexual development. And I mention that because on the bottom of R3, I mentioned the word adolescence. And adolescence, I wrote, is the period of emotional and mental development. In other words, puberty and adolescence do not mean the same thing. They do not. Puberty is when you become sexually mature. In girls, they start to become sexually mature, their ovaries start working, they start to physically change around the age of 11, 12, 13. Usually we'll say age 12. All right? So they are becoming, at that age, able to reproduce. In guys, it's about 1 year later. So it's about 12, 13, 14. We'll say age 13 in guys. So it's about a year later. That's when, so by time a female or a guy are 15 years old, they can reproduce. 15-year-olds can reproduce. 14-year-olds can probably reproduce. So what's adolescence? Adolescence is emotional maturity. That, unfortunately, comes later. It seems to me, if you were going to design this soul system, it would have made more sense to become emotionally mature before we became sexually mature. But we become sexually mature, by the time you're 15, you can get pregnant, but you're not really emotionally there. So adolescence comes really, now for women, it comes before guys, much sooner. Most women are starting to become emotionally mature by the time they're around 20, 22, something like that. With guys, about the age 47. I'm being a little facetious, but it takes much longer for guys. The reason why women become emotionally mature sooner is really because they have a reproductive biological clock, and guys don't. So they're not serious about their life or anything else because they feel like they've got forever. Right? But women don't have forever. And so they're much, a 22-year-old woman is serious, starting to get pretty serious about her life, whereas a 22-year-old guy is still shooting spitwads. So don't confuse adolescence with puberty. Okay, on this page are three, it just shows, here's the biological clock, there it is, right in your brain. And these are the changes that occur at puberty. I'm not going to read through this, you can. I think everybody is pretty familiar with the changes that occur in both males and females at puberty. These are these changes. But let's look on page R4. And R4, we're going to talk about the male reproductive system first, and then we'll look at the female. We'll start with the external plumbing, and then we'll go to the internal plumbing, as they say. So as far as the external genitalia, so basically what we see on the outside of a guy, the external reproductive parts, are the penis and the scrotum. And here you can see in the picture the penis and the scrotum. Now, as far as the penis goes, so the opening at the end of the penis is called the urethral orifice. The opening of the urethral canal. And what comes out the urethral orifice is either urine or sperm. They can't come out at the same time, but either urine comes out or sperm comes out, because it serves both the urinary and the reproductive system. Now, the head of the penis is called the glans, G-L-A-N-S, glans, that's the head. And this is the shaft of the penis. So if you're getting that, you know what you're getting shafted. Okay, this fold of skin is called the prepuce, we'll call it the foreskin. We'll call it the foreskin. If the foreskin is removed, that process is called a circumcision. Circumcision is removal of the foreskin. Now, the principal reason why the foreskin is removed is it's removed as a religious rite in Judaism and Islam, part of what the religious traditions are. There is no medical reason necessarily to remove the foreskin. There is some evidence of possible reduction in risk of penile cancer and some other problems, but there's no requirement that it be removed. But it is very common that it is removed in the United States. Not common in Europe, but it is commonly removed. If it's part of a religious ritual, so then they have a party. In both Judaism and Islam, there's a party after the, which will tell you that some people use any excuse to have a party. But if it's done not outside of a religious rite, then it's done by a pediatrician. A pediatrician would do that. And the main reason why, if it's not part of a religious ritual, why it would be done is so that the son looks the same as the father. The scrotum is below, and what's inside the scrotum are the testes, or testicles. We know that the testes descend down into the scrotal sacs during the 9th month of fetal development. And it appears that a failure of the testes to descend down into the scrotum sac may result in sterility, an inability to produce sperm, because it appears that normal sperm production has to occur at a temperature a little bit cooler than the rest of the body. Now, we'll speak briefly about erection of the penis. Erection of the penis has nothing to do with muscles. It has to do with blood flow. So if a guy says, you know, I got a lot of muscles down there, don't be impressed. It has to do with blood supply, not muscles. So what's going on is that there are blood vessels in the shaft of the penis that become engorged with blood. And that's called vasocongestion. You've heard of nasocongestion, this is vasocongestion. So these veins become engorged with blood, and it's like filling a balloon with water. If you fill a balloon with water, it becomes stiff. So that causes it to become stiff and erect. So in fact, if a guy has erectile dysfunction, or ED, which is why guys take Viagra, the Viagra drug basically helps promote erection by increasing blood flow. Okay, on R5, they've done terrible things to the penis in these pictures. So for most guys to even look at these pictures, these hurt just to even look at. This one kind of looks like a banana split. And this is where they whacked off the front of the penis. But after whacking off the front, we see these large veins, or venous sinuses. So we know that thin-walled veins are called venous sinuses. There are 2 corpora cavernosa and 1 corpus spongiosum. Now, I've given you all kinds of statistical data here. I'm not testing you on it. Okay, let's look on the next page, R6. Now, on R6, let me get your attention. This picture will appear on the final. Now I have your attention. All right, so let's describe this picture. So these are the testes. And testis is singular, testes, with an es at the end, is plural. That's common the way it's done in Latin. This is a cutaway view of a testis, revealing these tubes inside the testes called seminiferous tubules. It is in the seminiferous tubules where sperm are formed. Sperm are made in those seminiferous tubules. Now, right above the testes is a coiled tube. This coiled tube is called the epididymis. The epididymis, this coiled tube, is where sperm are stored. Sperm are stored in the epididymis. Let's go down further. Epididymis, 20-foot long, highly coiled tube for the storage of sperm. And as you know, I never test you on how long a tube is. Now, the testes. The testes have 2 functions, spermatogenesis and secretion of testosterone. The word spermatogenesis literally means to generate or make sperm, and that occurs in the seminiferous tubules. It takes about 64 days for sperm to develop. I'm not going to test you on that, so I crossed it out. But what I do want you to know is that what stimulates, what causes this production of sperm is FSH from the pituitary gland. That I want you to know. So it is this hormone from the pituitary gland that is needed to make sperm in the testes. Without it, sperm are not produced. The second function of the testes is to secrete the male sex hormone called testosterone into the bloodstream. It's actually produced by cells called Leydig cells. I will not test you on that. I will not. But what I do want you to know is what causes the testes to secrete testosterone into the bloodstream is the pituitary hormone called LH. All of this was summarized on R2, what FSH and LH do. Of course, testosterone is the masculinizing hormone that stimulates growth processes and stimulates libido, or sex drive. Now, at the bottom of the page, we mentioned the vas deferens. The vas deferens, or ductus deferens, I just wrote, carries sperm to the prostate. It carries sperm to the prostate. We're going to show you that, a picture of that. It's about an 18-inch long muscular tube that carries sperm up to the prostate. Let's just show you a picture of that. In the picture right above, so here it shows this is the vas deferens, or ductus deferens. During sexual arousal in a guy, the sperm that are stored, some of the sperm that are being stored in the epididymis start to be pushed by peristaltic contractions. These sperms start to be pushed up the vas deferens, follow the arrow up, 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 and these sperm are pushed into this structure right here called the prostate gland. This is the prostate gland. This structure right here. So the sperm are pushed up and start to fill the prostate gland. Now there's an actual cavity or chamber that fills up with these sperm. This is called the ejaculatory duct. So this is the ejaculatory duct of the prostate gland. That's really part of the prostatic urethra. You might recall the urethral canal passes, there's three parts to the urethral canal. We needed to know this for the test on the urinary system. There's a prostatic urethra, a membranous urethra, and then the cavernous urethra going through the penis. All right, so the prostatic urethra is the segment of the urethral canal going through the prostate. And that, right in the prostatic urethra is where it fills up with sperm. Now, that occurs during sexual arousal. Also during sexual arousal, there's a pair of glands right up here called the seminal vesicles. And they're called seminal vesicles because they secrete a fluid called semen. S-E-M-E-N. And that fluid also flows into the ejaculatory duct of the prostate gland. So during sexual arousal, the ejaculatory duct of the prostate gland fills up with both sperm and semen. The seminal vesicles release the fluid called semen, and the sperm came from the epididymis and were pushed up the epididymis through the vas deferens to the ejaculatory duct of the prostate. You'll notice in the picture it says location of cut for a vasectomy. So in other words, if the vas deferens tubes were cut and tied off, that's called a vasectomy procedure. Now the purpose of a vasectomy is to prevent pregnancy. Because obviously, if this is the tube that takes sperm and pushes them up to the prostate, if you cut that tube, then the sperm are prevented from going up to the prostate, and therefore there's no sperm that can be ejaculated out the penis. Now this always raises a couple of questions. One question is, well, what happens to the sperm if they can't go up the vas deferens? The sperm, like many other cells in our body, only live a certain amount of time. Our red blood cells live 120 days, 4 months, and then they die and we need to make new ones. We make new skin cells all the time. We make new cells lining our alimentary canal all the time. Well, the sperm only live a couple of months, and any sperm that are not ejaculated die. And the cells deteriorate, the chemicals are reabsorbed, and we make new sperm all the time. Guys make new sperm all the time in the seminiferous tubules of the testes. So that's all that happens if the sperm can't go out. The second question that is asked is, well, okay, so if you don't have sperm going up here, then does anything come out the penis during an ejaculation when a guy has an orgasm? The answer is yes. The semen, the seminal fluid. So the only way somebody would know whether there's semen, but the only way they know whether or not there's sperm mixed in with it is if they carry a microscope with them. So they can examine the semen under a microscope and see if there's sperm there. but there's still semen, that fluid, that still would be spurted out, which makes up most of the volume, more than the sperm. All right, so that's what a vasectomy procedure is. So in fact, on R7, if we look on R7, so we said a vasectomy prevents the sperm from coming out the penis. That's for sterilization. The seminal vesicles secrete most of this fluid called semen. The prostate gland is located just beneath the urinary bladder. And the urethral canal passes through the prostate. And in case you're thinking, I don't follow you, so you'll remember this picture, which we saw in the urinary system. It's the same picture that we saw in section L. So here it reminds us that urine in a guy can go from the urinary bladder through this urethral canal. So in section L, I talked about how urine goes out this way. Right now, I'm focusing on the reproductive function, how sperm and semen fill up the prostate, and they can be spurted out the penis during an orgasm. So it has both functions. And here we remind you this segment's called the prostatic urethra. We remind you also that there are various diseases and disorders of the prostate. So and that includes carcinoma of the prostate. That's prostatic cancer. Now, prostatic cancer is one of the more common types of cancer in guys. Now, the good news is that the guys who usually develop prostate cancer, usually doesn't start to happen until over the age of 60. So it's really rare for a young man to develop prostate cancer. The second thing is, in most cases of prostatic cancer, it metastasizes, it spreads slowly. So it can usually be dealt with, okay, either surgically or chemotherapy or radiation and so on. But it does have to be dealt with. Obviously, if they don't deal with it, then it will spread, and guys can die from prostatic cancer. Sometimes the prostate just becomes enlarged or hypertrophy. It's actually quite common in guys for it to get enlarged. And when it is enlarged, it actually causes stenosis or constriction of the urethral canal, urethral stenosis, and makes it hard to pass urine out. But that's not necessarily cancer. On page R8, on the top of R8, I mentioned the Cowper's glands, or the bulbal urethral glands. These are two small glands that secrete a clear, sticky, alkaline fluid into the urethral canal during the very beginning of sexual arousal. So you might say, what's that? Let's go back to R6. In our picture on R6, so these are the Cowper's glands, right here. This pair of glands right here called Cowper's glands, or bulbal urethral glands. And these Cowper's glands secrete a clear, sticky, alkaline fluid into the urethral canal at the very beginning of sexual arousal. So that when a guy first starts to get sexually aroused, there's like this sticky fluid that appears at the end of the penis. It appears that the purpose of this fluid is to, since it's alkaline, it has an alkaline pH, its purpose is to neutralize any acidic urine that is still residing in the urethral canal. Urine is usually acidic, and the acidity of urine might kill the sperm. So it's believed that this alkaline fluid is released into the urethral canal early in the sexual arousal, even before the sperm have been ejaculated, to neutralize any acidity of the urine that's still there. That's what it's believed to do. All right, so on R8, semen, here I've given you all kinds of information about semen. I'm not going to test you on this. I just want to draw your attention on page R8 that the normal sperm count, and I'm not asking you to memorize it. The normal sperm count is 120 million sperm per milliliter of ejaculation. What's amazing, and incidentally, a guy usually ejaculates about 3 milliliters, so that's 3 times 120, or 360 million sperm in the 3 milliliters of ejaculate. What's amazing is that if the sperm count becomes less than 20 million per milliliter, the guy is effectively sterile. And why that's amazing is that there's only one sperm that's going to penetrate the egg. But a guy who has less than 20 million sperm per milliliter effectively cannot cause pregnancy. So you'd say, well, if he's still got 20 million sperm per milliliter, how come he can't cause pregnancy? And that's because when the sperm, when he ejaculates the sperm into the woman's body, most of the sperm get lost. They never find the egg. Remember, they won't ask directions. So most of the sperm never find the egg. They get lost in the female reproductive system. So it takes a lot of sperm to increase the probability that some of them are actually going to locate the egg in the fallopian tube. All right, here I've given you all kinds of information about semen. Again, I'm not testing on it. A few words about sexual intercourse. So the actual clinical name for sexual intercourse is coitus. Coitus. That's just another term for sexual intercourse or copulation. And in both men and women, I wrote both. During sexual arousal, there is an increase in muscle tension throughout the body. The muscles, the skeletal muscles of the body tense up during sexual arousal. Now, in a guy, so I wrote guy here, in a guy specifically, there is emission. Emission means release of sperm and semen into the prostate gland, right? So we had mentioned that during sexual arousal, sperm from the epididymis and semen from the seminal vesicles will be released into the ejaculatory duct of the prostate gland. Now, as this ejaculatory duct of the prostate fills up with sperm and semen, as it fills up, it creates a fullness, a sensation of fullness in a guy. And the only way I know to describe it is I'll use the common expression, a guy has a coming sensation. He feels like it's getting really close to coming, right? To ejaculating. And what's creating that sensation that he feels is the prostate. The prostate is filling up with sperm and semen, and that's what creates that sensation. Now, most guys don't say when that's happening, oh, my prostate's filling up with sperm and semen. They don't know what's causing it to happen. They probably don't care what's causing it to happen, but that's what's creating that feeling or sensation, that it's getting very, very close to them having an orgasm, to ejaculate. Now, back on page R8, so in both males and females, there is the orgasm, or climax. And during the orgasm, in both men and women, there are these involuntary contractions of skeletal muscles throughout the body. So there's these convulsive contractions of muscles throughout the body, including the genital areas, but even throughout the entire body, and that accompanies the orgasm. After the orgasm has subsided, these involuntary muscular contractions, in both men and women, there's an overall decrease in muscle tension. And that's probably what accounts for the good feeling, at least in part, is there's this buildup of muscle tension during sexual excitement and arousal. And then these muscles contract rhythmically, involuntarily, and so then when they're done contracting, they're very relaxed. On page R9, so this picture you'll recognize on R9, our official dirty picture, because this originally appeared on page C1. You might remember that on C1, that was the first page of embryology. And we began by explaining how you get pregnant and how a baby develops. So here we are near the end of the course. We're back to the same thing again, but we're looking at it now from the perspective of the parents rather than from the baby, because then we were seeing how the baby develops. So here, of course, we have coitus or sexual intercourse or copulation. The penis is inserted in the vaginal canal. Sperm are being ejaculated out. You can see them coming out the end of the penis. The penis, the head of the penis is towards the top of the vaginal or birth canal. The sperm swim up the uterus, and they swim up into the fallopian tubes. And if there's an egg in the fallopian tube, then the sperm can unite with the egg, and that's called fertilization. I've summarized how the sperm get out of the guy's body and where they're going in the woman's body right here in the paragraph below. I even describe how long it takes for the sperm to swim right here from up to the fallopian tubes. It takes about 45 minutes. I'm not testing you on that. But I'd like you to take a look at page R28. And on page R28, so on R28, I wrote the following, and I only wrote it here because it's the only place where I could fit it in, and I wanted to add this. So I simply wrote on R28, to summarize, sperm are produced in the testes, in the seminiferous tubules of the testes. They are stored in the epididymis, that coiled tube above the testes. Then the sperm are pushed up the vas deferens to the prostate gland during sexual arousal. Then the sperm are ejaculated, right? They're shot out of the urethral canal of the penis during the orgasm. That's called ejaculation. And in the case of intercourse, so then the sperm are released into the top of the vaginal canal. They then swim up the uterus and up into the fallopian tubes. That's where they're headed towards. And if there's an egg in the fallopian tubes, then fertilization or conception can occur. All right, so I just remind you of that. Back on R9. On R9, so at the bottom of R9, diseases and disorders in the male reproductive system. So what is impotence and what is infertility? These are very different. Impotence is an inability to attain or maintain an erection. That's called erectile dysfunction. Infertility or sterility is a low sperm count. So we could imagine a guy who has a high sperm count but may have trouble with having an erection or maintaining an erection. Conversely, we can imagine a guy who has awesome erections but could have a low sperm count. So these are different issues. Now, one of the things that could cause a low sperm count is failure of the testes to descend down into the scrotum. And that's why we said that the pediatrician will check that after the baby is born, boy baby, and if they fail to descend, they'll do a surgical procedure to pull them down into the scrotum. On R10, I'm not going to talk about these issues on R10.